The amount of false information being posted online about medicine and science has surged during the pandemic. YouTube temporarily suspended Republican Senator Ron Johnson on Friday for violating its medical misinformation policy. The Wisconsin lawmaker had posted a video where he advocated for unproven COVID treatments. Dr. Narula shows us what social media companies like YouTube are doing to stop the spread of misinformation. It is a big problem. Doctor, good morning to you.
Good morning, Tony. As it turns out, we have an emotional relationship to information, and I learned misleading information often spreads so quickly out of fear. Companies are now finding innovative ways to try to nip the issue in the bud, and on-the-ground efforts are being made to educate communities and arm them with accurate, fact-based information.
We're trying to give some information on the vaccine to our people in the community.
For over 3 decades, nurse Kathy Avery has made it her mission to offer medical education through door-knocking underserved communities in North Carolina.
A lot of these people are low income, no income, and for me, it breaks my heart because people aren't trying to give health care in these environments. And so the only person they may have is me. Well, help us pass the word, okay?
Okay.
It's a grassroots effort to combat misinformation and conspiracy theories.
You need the vaccine for real.
Yeah. If you can't see how people really live, then you can't help them. When you're out there door to door and you're talking one-on-one with people, you can hear all the craziness that they read on Facebook, and then you can give them real information so it's understandable, so it's not misunderstood.
The challenge is that most of us don't have the training or the background to discern fact versus fiction.
Jennifer Granston leads the team at Signal, a leading media intelligence company that is working to track and report medical misinformation.
You'll see here Bill Gates created the virus at 1 million mentions. 5G causes COVID at about 500,000. We still see things around hydroxychloroquine. These things tend to spin and spin and spin.
Since the start of the pandemic, the company has pulled in over 3 billion stories related to misleading and false narratives around COVID and the vaccine.
Oftentimes you can see within the hashtags of what's being shared a more deliberate effort to spread misinformation, and you can sometimes trace that back to a particular group or a set of actors that are doing that.
A government census recently found that 36% don't trust the vaccine. Almost 29% don't trust the government. Do those numbers correlate with what you're seeing?
Absolutely. What our job is to really identify those things that we see emerging online and put it in the hands of the people that are going to be able to make decisions with it.
In the hands of social media platforms like Twitter and YouTube.
Misinformation has dire public health consequences.
Dr. Garth Graham heads a new YouTube partnership with well-trusted health organizations like the American Public Health Association and Mayo Clinic to counter myths with fact-based medical videos.
So we give them the science, but in the culturally specific and a culturally appropriate way. Video allows you to deliver digestible information in the right format and reach people in the right way.
Your body's not making the whole virus. You can't get the infection from the vaccine.
What vulnerability did COVID expose in terms of our ability to get information to the consumer?
What COVID showed was that we needed to do a better job of at least first empowering individuals with information immediately. As we develop the science and disseminate the science, we have to be able to give people that information in a timely manner. We need to reach people where they are, where their minds are at, where their hearts are at.
That's why on-the-ground community efforts by people like Kathy is crucial.
How do you convince them that your information is correct and not what they heard last week at their gathering with their friends or on Facebook?
You have to keep listening. You have to let them say what they think and they feel, because then they feel respected, they feel heard. And that's the only way you're going to change people's minds, if it's going to happen at all, is to show that you're willing to listen, and not just listen, but understand where they're coming from.
I also spoke with Claire Wardle, who is advising the Biden administration on combating medical misinformation. She says it's critical to build trust one-on-one in communities, to have conversations based on empathy, and to realize that we can all be potential publishers and vectors of misinformation if we're not careful. There's a responsibility we have every time we comment, retweet, or share on social media. It is important to be mindful that our actions have ripple effects that spread way beyond us and our immediate contexts.
Such an interesting point you make, Tara, that misinformation can essentially be emotional. that because people develop fear, it travels much faster.
That's right.
It used to be so obvious what the difference was between good information and bad. There was an authoritative encyclopedia of medicine, and then there was the flyer underneath your windshield wiper.
Right.
And now they're both just on Twitter, and you have to make a different distinction.
Yeah, that's right.
But the importance of that one-on-one connection, like what Nurse Kathy was doing, is huge. Especially, stories I've done on healthcare on vaccine hesitancy.
Yeah.
Doctors keep saying it's when you're one-on-one with the patient in the room, or on the virtual meeting where you can convince people. I'm sure you've had that
That's
experience.
exactly what I find in my practice.
Yeah.
It's that one-on-one, those couple minutes where you just spend to explain it and to educate, and then suddenly the patient says, okay, I think I'm going to get it. So.
All right, Tara, thank you.